discussion is the suggested thromboprophylactic doses for antenatal and postnatal patients where we have to give low molecular weight heparin. Now, this is the table that we have to remember from the Green Top guideline number 37A. Now, the easiest way to remember this table is the Arabian Nights story of Ali Baba and the 40 Thieves, because the number 40 is the most important digit that we have to remember this table. So now we all know that patients that come into our clinics for antenatal or postnatal prophylaxis are mostly 50 to 90 kgs. Somewhere in between this range of weight. And anybody who has worked into the obstetric department has used Enoxaparin or Clexane or Lonopin. These are the brand names, and the most commonly, or I would say maximally used dosage of Enoxaparin is 40. So this golden number of 40 is the most commonly used value of low molecular weight heparin. And the weight range for the patients where we use 40 is 50 to 90, which is again the most common weight range we come across when we are dealing antenatal or postnatal patients. So most commonly used value is 40 and weight range is 50 to 90. So the difference again, range is of 40. 50 plus 40 is equal to 90. Now this 40 magic number, it has another use in this table, and that is for every subsequent increase in the dose of anticoagulant, we have to add 40 to the weight range. That means what? That means here, since it is 50 to 90, so the range is 40. Again, for the next range, we will have to add another 40. So it becomes 91 to 130. Then again 140 till the weight becomes more than 170, because this is a very rare weight range that will come across. More than 170 kgs is not something which we generally come across. So this is the maximum which has been given and above. So in the rare cases where there is extreme obesity and the weight is more than 170, then depending upon the weight we will give the doses accordingly. Okay, so 40 is the magic number of this table because the most common value used for Clexane is 40, and to remember the table we have to keep adding 40 to the weight range. So that is the essence of the story of Ali Baba and the 40 Thieves. So now it becomes very easy to remember the value of Enoxaparin, because the first and the last range is less than or more than, and in between we have the range of with a difference of 40 every time. So you keep adding 40 and you get the weight range. Now less than, of course, now suppose now the first value for Enoxaparin is 20, Dalteparin is 2500, and TINZAPARIN is 3500. Now for Enoxaparin it's very easy. We now know, and one more thing, the first value is the most important value because we go on adding the same value to get the subsequent doses. Like if the first value for Enoxaparin is 20, you go on adding 20 and you get the subsequent values. Similarly, for Dalteparin, the first value is 2500. You go on adding 2500 and you will get the subsequent values. And for TINZAPARIN, the trick is a little different. Here it is 3500. You skip and you double it up. 2 into 3000. Then the second value is 4500. You skip 1 and you double it up. So basically there are only 4 values that we have to remember for all of it, of which the most common weight range and the most common value used is 50 to 90 kgs, where 40 milligrams daily enoxaparin is given. The first dose in the chart for enoxaparin is 20, dalteparin is 2500, tinzaparin is 3500. The first dose is the value that we have to add on every time to get the subsequent doses for enoxaparin and dalteparin. For tinzaparin, it is the skip and double rule that we have to follow for tinzaparin. And yes, we are done with this table, which looks so scary, but it's actually a little trick that we have to apply, and anywhere, anytime, if we are asked about this table, we will be able to answer. Now, 2 more important points I want to tell about this table is that when the weight is more than 170, in those extreme rare cases, now we have to give doses according to the weight of the patient. We just cannot give it as a whole number. So next you have to remember the units. So for enoxaparin it is milligrams. So you can remember it through Maggie, that is milligrams for enoxaparin, and the rest of the 2 are units. Okay, units daily. And there are a few cases where the patient is on long-term anticoagulation. It could be antithrombin 3 deficiency patients, or any kind of high-risk patient where there is long-term use of anticoagulants. So these patients will not, this dose will not suffice for those patients. For them, we have to give this dose twice a day. So for high prophylactic doses of women, we have to give the doses 12 hourly. This is an example which is given. So basically the idea is to double up the doses. It has to be given BD for a better protection in high risk patients. Now for those where the weight is more, the mg per kg per day is what we have to remember. So 2 values here, 0.6 and 75. This is again mg and this is units per kg per day, because it will we'll have to deliver higher doses at this high weight. So we will give it according to every kg increase in weight. Okay, so we will have to give it according to the weight of the patient. Doses calculated according to that specific weight. So 1.6 we have to remember, 75 units per kg per day. This is only for this rare instance where the weight is really very high for those patients. And one more thing that we have to remember is that for enoxaparin and dalteparin, we have to be very careful about the enoxaparin and dalteparin. The creatinine clearance is important. So if the creatinine clearance is less than 30, we will have to decrease the dose of low molecular weight heparin and of course dalteparin. And for Tinza it's 20. Okay, so for Tinza, doses adjusted if the creatinine clearance is less than 20 ml per minute, and for ED it is 30. ED 30, Tinza 20 is what we have to remember. So the take home messages for this chart is the golden number of 40 for the most important used dose and the age range for the chart. Then the first doses of the three tables, that is 20, 2500 and 3500. Number 3, in high risk patients we have to give a 2x dose. Then the first value adds on to give the subsequent value. For subsequent values, but for TINZA it is skip and double. So this is in, and yes, and the units, that is maggie. Maggie means milligrams for enoxa, and DUT, that is units for D and T. So this is a nutshell that we have to remember about this table. Please try to remember it on your fingertips so that patient management also becomes easy for you. And once or twice, if we go through this screenshot, then definitely it will be very, very easy to remember this table. Thank you.